You're watching HCAM TV.
Hello, Hopkinton. Welcome to Thursday's edition of the Hopkinton Hangout Hour. I'm your host, Mike DeRosian, and today, Thursday, September 24th, 2 p.m., and you're on HCAM. With me today, Bob Hamilton, my co-host. How you doing, Bob?
Hi, Mike. I'm doing all right. We're just waiting on Shaun or Kasey to come in.
Yeah, so that means we will be talking slow as we wait for Shaun and Kasey to show up to discuss this week's update of the Board of Health and all things COVID and health-wise going on in town. And so we're just gonna hang out. Bob and I will be hosting a couple shows this week. We have tonight the Gathering in Quarantine, where Terry Melisi will be making a football fever dinner. That should be a lot of fun, Bob. She's got all the good tailgating items on hand for tonight, and she's got to do it all within an hour, get it all ready to go. So, and then come tomorrow, Friday's edition of Keep Moving will be a repeat, which we'll bring Matt in before we transfer over to our second segment. We'll bring him in to discuss what's going on Friday, and a new show at 7 p.m. on Friday with Cheryl Peralta. So, seeing that he just made it in, he looked like he's all out of breath. Must have ran into his office. Is Shaun McAuliffe? Hey, Shaun.
Hey, sorry about that.
Hey,
that's fine.
Oh, look, you got a new look going for you in the background there. I see you're back in town hall.
Yep, for probably another week or so, and then I don't know. I'm kind of nomadic. I'm either gonna go back to the fire department or I'll go downstairs to Kasey's office.
Well, at least you have a place to go. That's always good.
Yeah, it's I have bags everywhere. So like today or last night, I was trying to finish a grant, and I'm like, "Where's my? Oh, it's at the fire department." To get the paperwork.
Well, thanks for taking the time out of your day. We really do appreciate it. So let's see. Let's talk numbers. We only have one active case still, I believe.
No, we got two.
Two. This is why we have the updates. You know, we get the state one that says one, but we get real time information from you.
No, we have two under the age of 23. Both of them likely picked it up at parties where they weren't wearing face coverings. And
yeah, are you seeing a little trend somewhere with this here? You know, you had the big thing in Dover Sherman, you had another one in the North Shore. I mean, I just don't understand why you just can't keep the mask on.
We've I think we've had a case, like we've had we'll call them, we've had like a college kid just about every day for the last 2 weeks, easily the last 2 weeks. And we've been helping some residents from other towns deal with their kids that are coming back. So, cause it's, like for some of the parents, they get the call that they got to come pick their kids up because they closed down the dorms.
Sure.
And then their kids might have a negative test on record. But we're like, you got to make a plan, and it depends on when that negative test came in. And in this one instance, it turned out that the child, the day after we had a discussion, the child tested positive. So it's, and that's what's keeping me up at night right now.
Yeah, sure.
Is how are we going to get all of our kids back for the holidays, knowing that, they're in a higher risk environment, and and we want to make sure that we have a good solid plan in place to help the parents think through this. To maybe I'm going to have the grandparents over and not the kids.
Right, exactly. That's the truth. The grandparents are more at risk, and we're talking about kids that are going out of state, coming home, and we know we're safe up here in New England. Rhode Island's still a bad state, right? Is that correct?
Yeah.
So
a lot of cases coming out of Rhode Island.
So we have that here, and now we're looking at the schools opening. You got elementary all the way through high school opening, and you're hearing some closures as towns switch to red, closing down their schools, or parties closing down schools. You got that going on, and it's not like keeping we call them kids. We still use the term kids, even though we're talking about college
Right.
age people, and those are supposed to be more adults, and but you still classify them as kids, but it's not a problem at the elementary and high school levels. It's them going off to college where things are more open and less supervision. Less supervision means more exposures.
I mean, I'll tell you, yesterday was probably the first day that I was out, and every child I saw on the street had a mask on, and it made my day. When I left town, it was a different story, but but it seems that the parents and the children are having those conversations, and then everybody's kind of getting it now.
Right.
And then, like you said, those that don't have a lot of supervision, it's going to take, and it might be one of these things that Thanksgiving it ends up being a positive kind of experience in town, where the kids that all got sick are sharing stories with others when they're distanced and masked. But that was terrible. I was two of them have been like the cases that we've had recently. It's just like, it's been like the flu, like a hard flu, where they're just sleeping all day. I remember when I was a college kid, I slept all day, but they're really wiped, and then but just the ones that are home, that just puts an added strain on their parents and on the rest of the family members. It's there's this, it's the trend that it's, you get the call, Kasey or I make the call to the child that we just got your results, you're sick. Then we typically call the parents, and then then you see within a day or two, everybody in the family gets tested, and then we're able to have conversations to figure out how do we keep everybody healthy that's at the home, and how do we care for the person who's isolated.
Sure.
But it's this, we just, I just saw the last set of results today, and the family members have all tested negative. But it just brings a whole added stress to people's lives. And that's one of the things that we want everybody to understand, is that, maybe you're only, maybe you only have a light illness for a week, but if you're living at home, your parents, they can't go to work.
Yeah.
Your siblings are now home, and there's just a lot. It's one of those things where you just got to remember that, again, your activities have they may impact a lot more people than you
Absolutely.
thought.
So Shaun, these two, you mentioned that there are two cases in Hopkinton now. How did those come to your attention? Did they come to you and say that we think we have it? Did they get tested?
No. We, I get your medical results at the same moment your physician and, so as soon as the lab releases the results, it goes to me, the state, and your primary care physician.
So if somebody goes into their primary care physician, says, I feel sick, they test for COVID, it comes up positive, they already know where, in what county, what state, what town, and they notify that local board of health that here's another case of COVID?
Yeah, that's the way that this system is designed.
Good.
And then it allows us, so then, like with one of the cases, we started our contact tracing and we found something interesting. And then I was able to go online and basically have a direct conversation with the state epidemiologists and start investigating this further. And then, and this is it's an interesting, it's when they say like peeling the onion, this is peeling the onion. And the more you got into this, like we started uncovering more and more cases, and it's going to be one of the more it's going to be an interesting case. And and again, I feel terrible for the the resident in town, because it's really the only thing that they did was they went to a gathering, and there's a question about whether or not people at the gathering might have known that they were at risk of having the illness, or and then they should have, if they did, they should have known better not to be out and about, because I can't get into too much detail, but
Exactly. Yeah, and
but-
you know that, one of the biggest concerns is the people that have it that don't know it, that are acting irresponsible,
Yeah.
or just not acting responsible. I guess should be the way to do it.
But if they don't know that they have it, how can they act any other way? The only way you can tell, or at least suspect you have it, is if you have symptoms.
Right.
Then you can follow up.
But they, in this case, they may have known that they were at a much higher risk from things that they were involved in,
Right.
or people that they were involved with.
Right.
And right now it looks like it's at least 4 states, and there'll be at least 10 communities, I think. So it's and this is, again, it's this whole, like I have this discussion all the time with my family members, and we're having one right now where how your nuclear family, and even the governor talks about this every day, that like I have contact with Nadia in my office, Kasey, the fire chief, and Deputy Miller. My wife has contact with maybe 2 or 3 people, and then we have a good idea of how much contact our contacts have, and like I like to think that we've got everything kind of buttoned up. But then when you start broadening out, and hanging out, going out to dinner with people, and you just don't know how much other contact people are having. And and it's just something to calculate, or kind of consider. I've been invited to a big party, this weekend, and and it's a big family type of event.
Right.
I'm like trying to figure out, I might just stop by and hand someone a check and say, congratulations.
Yeah.
But it's too big. It's going to be in a high risk community. It's tough.
Yeah.
Well, you gotta make those tough choices, and it's just not worth it. I mean, you think of it. Do I really want to be out of work for 2 weeks? Do I really want? I mean, yeah, you can go test it and find out that you're fine, but what if you're not? And you don't test, and all these things. It's just it. It's this kind of stuff isn't worth it, and that's.
No.
It's a shame that you got to think like that, but this kind of thinking is getting us out of the hole. As speaking about getting out of the hole, I see as things get colder, the restaurants are going to be able to fill up a little bit more. I understand.
The governor was just talking about that this afternoon, and is what he and his team have been, I guess, discussing with the governors of all the New England states, New Jersey and New York, about what their data is showing. Like they were basically running risk calculations on restaurant exposure, bar exposure, and other things. And at the end of the day, they believe that opening up the table counts to 10 was safe. They're not touching bars, and then the other modifications seem pretty reasonable. I mean,
Right, I believe, I know the bars themselves, the bars that don't serve food that are considered restaurants, can't open, but the restaurants that do have bar seating will allow single occupancy at those schools.
Yeah. And
that's a major change, right? That's a huge change.
Yeah, no, I mean, you ask Peter at Carboni's and about the discussions we had about
sure.
if I did, and I'm like, I said, like, I haven't been yelled at very often. and the guy from the DLS is like, for the love of God, I told you, if the word bar isn't anything, it's a no. Stop it. Stop it.
Well, that's. I mean, it's good to see because at these restaurants that do have the bar seating that can't be used, now you're freeing up a table that has that one person who is dining by themselves,
right,
and is normally set up for 2, 4, or 6 people, is now being freed up for that. So right. I see that being a big help. Parties of 10, I like the 6 because I'm saying that's a family,
right?
But 10 is a party.
I know, and I'm not.
That's a party. That's my family and your family.
I'm a risk manager, and I don't like the 10 because I have a hard enough time. Even like Connor and I, after town meeting, we finished up. We broke everything down, packed it away, and then I was getting my wife a couple like a lobster roll, and Connor was stopping to get lunch, and so we shared a beer, and it's like I can see your head just buzzing, like I was monitoring who was by, and I'm like, no, I've actually done an assessment over whether or not anybody around us has symptoms, and he's like, you must be a head case right now. I'm like, I'm trying to sit down and enjoy this beer, but no.
It's a tough way and you have to think that way just to go out and just to enjoy a beverage. But I mean, it's the world we live in. I mean, I look at myself, I used to drive a truck for a living, and I was always a very offensive driver. I was very aggressive and whatever. Then I get my motorcycle. Well, I drive very defensively on the motorcycle because I don't trust other people.
Yeah,
I don't trust people mowing their lawns with the grass clippings blown out in the street. I don't, all these things, watching every pothole, dead animals, whatever.
Right.
So you drive a lot more defensive. And now you have to be this defensive to go out and get a burger. If
Right.
you want to go out and get a burger. I mean, believe me, I learned. I started doing the Hello Fresh stuff at home, and just cooking up all different ideas instead of having the same thing over again, which keeps me going out to the restaurants because it's still not the best. They're making it safe.
Yeah.
All these restaurants are following the guidelines. Speaking of that, plexiglass, right? So instead of having tables further apart, they can be closer together if they stick plexiglass.
Right.
Right. So that right there just reminds me. It's like, wow, we just moved the buffet to the dining area, with the plexiglass. And can I say that buffets are now dead in Massachusetts?
For the near term, yeah.
Oh, I mean, even after, let's say, everything's back to the way it was, do you see this being the death of buffets? You see,
I wouldn't necessarily mind that.
I don't think there's enough sneeze. I don't think there's enough sneeze plastic in front of those things, anyways. But
no, but
especially when they're up here and you got the little 5-year-old reaching in out here.
my favorite inspection was at Mass General, and we went by. I was walking with the food service director there, and I saw this doctor reach in and grab an olive, and you would have thought that the guy had pulled out a gun. And the director, she was 4'0", like she came up to my shoulder, but they called her the Bear Claw, and she like dressed him down, had him like cowering, and I'm like, what do you like? You're a physician, you know better than to put your hand in. Like, so we stripped the bar down and made a scene, and then I joked. I mean, I was the norovirus leader for the city of Boston, and when my wife, like I said, you figure out what you want to do for a honeymoon. So she booked a cruise.
Was it in a rowboat?
You got to be kidding me. I'm like, you're not going to put me on it. But, we went on the cruise, but I just said, I'm not touching a buffet because that's where, a lot of the norovirus illness comes from. So
a cruise itself is a floating petri dish anyways.
Yeah. It was, again, I mean, I'm kind of a head case when you hang out with me, because from my environmental background and my health background, it's like I see risk everywhere, and
sure,
and my wife can read it on my face. And
oh yeah, I bet you're fun to go out to dinner with, right?
Yeah. It's, I mean, I got a host of stories, but yeah.
Does your wife always say to you, don't look, don't pay attention, no? Because you're ready to stand up and say, hey, don't do that.
She's good about, she knows that I rarely get up and correct people. I think the last time I did that was like 6 years ago in Florida, where I was watching a guy roll up. He was doing some bad stuff with sushi, and I was like we were close enough that I was like, you got to be kidding me. And the sushi chef looked up at me, and I had my badge with me, and they were like, someone's like, what are you, a cop? And I pulled out my badge, and then everybody stood up, and then I was like, let's get out of here. We went next door, and then all these people followed us out.
We're reading where he goes.
Yeah.
Well, Shaun, before we get too, I'm sorry, I didn't mean to cut you off.
No, I was going to say we were in Celebration, Florida.
Yeah.
And we left the sushi bar and went over to this place, and it was owned by a guy from Boston. And I was like, you give me a burger, chowder, everything that's cooked, handled with utensils, and that became our place to go, whatever we were down there.
So what I was going to ask you was, last week you had the drive-up flu clinic, and I know I went and got my flu shot there, and Kasey did an excellent job. My arm's out of the sling
Yeah,
now,
yeah,
so.
yeah, yeah.
No, how did that go? Do you think it was a success for the town?
Yeah. It was a good it was a good first run. I think we're gonna run another one early next week for kids. And then we're starting to get the bulk of our other flu vaccine in. So we'll host another one. And then we're starting to stock up on, we have multiple grants that are out where we're gonna get, portable generators and all the um, mechanical equipment to hold these events outside and larger tents, just
Nice.
to really, because the reality is that, if we're looking at the first two COVID vaccines coming out, both of those require 2 shots. So we're going to basically have to run at least, probably maybe up to 4 or more vaccination clinics. Or what am I saying? 4 or more sessions, and then each session will be probably 5 to 7 days in duration. And so I'm like, we got to make sure that we're properly equipped to be able to pull this off. And
Because you're gonna need heaters. You're gonna need all sorts of things.
yeah. We're I'm about to put in an order for like durable portable vaccine stations that it'll basically look like a when you're like watching a like rock concert footage. It's all, they're decked out in diamond plate, but then all the covers convert to tables, and
Yep.
And they all carry fridges, and then you basically just have to attach a portable generator to them, and
Nice.
and then and it'll just, because we're going to need multiple, we'll have probably 2 or 3 vehicle lines with, 2 to 5 people giving shots out.
Yep.
I mean, it's the large scale clinics are going to be, it'll be an interesting exercise. And that's why these clinics that we're running are all designed to help us figure out how do we pull this off. And
Right. Like for instance, you had like down the seaside, you had a nice loop for cars, so they wouldn't be backed up. And you're gonna say, well, that worked out good, but now this is gonna be twice the size. Oh, we're gonna need twice the loop. Oh, we can't use this area.
no, and like
Great practice.
it was, maybe we got to pull the table back a hair to accommodate turning radiuses and how the signs are posted. And
Yeah.
I at one point I said, the greatest risk here is one of us is going to get our foot run over. So maybe we should wear, steel-toed boots, and we're just, it's giving us pause. Then we sit back after every clinic and go, all right, what went well? And in that, even the last one, we said, we must know that we need the more powerful Honda generators,
Right.
because the little ones can't support the portable freezers.
Sure.
We need, having the tents was critical. Having stuff protected from wind, and then like, I think I was the only one who had a near miss. And then what do you do when you get walk-ins? Like at one point,
We had that woman.
Yeah, we had 2 of those. So it was, we should have a line where people can walk up.
Right.
So it's just a lot of logistics to work through. And
well, I'm sure you guys will do it. I mean, you guys are very smart. You learn it as you go. You keep improving, adapting, and overcoming everything. But we're gonna cut our time short. We're only half hour today.
Okay.
And but I want to thank you and have you back again next week. You and Kasey, or you or Kasey, whatever works. We'll take one of you. We'll take both of you. You guys are fantastic.
Like today she's home with she's got her kids at home today. So
Excellent. All right,
And you can pick the location you want, upstairs, downstairs, firehouse, doesn't matter.
Yeah.
All right.
Am I-
So we have to get running because we have to get ready. I just want to tell everybody, Shaun, first off, thank you again. We'll see you next week. Want everyone to tune in tonight to the gathering where we do a football dinner, football fever dinner. And tomorrow night we have conversations of unity in healing with Cheryl Peralt and Carolyn Waters. So stay tuned. Next, we're going to see the replay of Tuesday's update with the Hopkins School Superintendent, Dr. Carol Kavanaugh.
Take care.
So welcome back after the first week of school having started in Hopkinton.
Mm-hmm.
And what should we talk about first? Should we talk about driving and parking, or should we talk about how things have been going inside the four walls?
I am absolutely happy to talk about traffic and driving and parking and all kinds of things like that.
All right,
Great.
let's get the update on that. I believe there's been some changes and some learning that's already been going on. So tell us how things started and how things are going with driving to school.
Okay, so you'll remember last time we were together, you were good enough to show the video of how traffic patterns should work on Hayden Row with the middle school and high school. And I think it was only about 48 hours later that that we actually had people who were backed up all the way to CVS or all the way to the Milford line, and it was absolutely crazy out there. So we have made some changes at the middle school. What we're doing now is we're admitting our 6th, 7th, and 8th graders into the building. They go to different locations. They're seated and socially distanced from one another. So that's been working out a whole lot better. If I can encourage people to do one thing, if you're pulling into the high school and you don't see people who are in the old bus loop, just loop right in through there. I guess what should be in every driver's mind is, how do I take my car in off of Hayden Row Street? Just so that the people who are, regular citizens in Hopkinton not coming to our schools can also pass through the Hayden Row Street piece. Item number 2 on my transportation traffic list. We had reached out in the summertime to say to families, we could really use your help if you were able to drive your children. And we were really, really fortunate in that so many people could do that. Now we're kind of reaching out and asking people to go a little bit in the other direction. We have put to date about 200 students back on buses, which has been wonderful. So that I think should be helpful in eliminating some of the automobile traffic. At the elementaries, so at Hopkins and Elmwood, we still have some backup there. So if people could be, try to be a little bit quicker getting your kiddos out of the car, back into the car. One of the things that I think will help at Elmwood is we have done, we check parents' licenses to make sure that we're not giving our students away to people who we shouldn't be giving them to. So we have, car window plates that will help a little bit. And once we get more kids into the buses, that should help. But a very funny story from last week, we had an 18-wheeler that just came right into the building at dismissal time. And that really created some gridlock down there at the Elmwood School. So that wasn't so good either.
Are you making a delivery to the school at that time?
Well, you know what the person was delivering and we didn't know it. We've ordered storage containers because when we started to separate the desks in our classrooms, we had to move a lot of desks out. And they've been in places like in cafeterias, on stages, in hallways. And so when we got these great big storage containers, but they're so large and so heavy that they come on a flatbed and they have to be lifted out with a crane. So what we didn't know was the 18-wheeler was actually the Elmwood storage container. So when we told that poor driver that he needed to move his truck, his storage container is now at the middle school.
Oh.
So Elmwood will eventually be getting a storage container, but not at dismissal time, we hope. So.
Right.
Yeah.
So you know what? I haven't been in the middle school. Where is all this stuff now that's going to be going into the storage container? Like for example, in Elmwood, I mean, because from what I've seen in the schools, there is very little to no storage available in the schools. All the spaces are used. So where are they piling it up? Have you seen?
I think, so this is a terrible thing to say because I see piles of furniture everywhere. So I think when I was in the middle school the other day, what used to be the area of the cafeteria where kids were sitting and eating lunch had an awful lot of stuff in it that was heading out to that storage container. You know, if you go into Hopkins and you look at the stage, so where kids are sitting in the cafeteria, if you look up on the stage, there's an awful lot of stuff up there that, and you know, we don't know how many kids we'll need to accommodate as students move into the district. Maybe we have some remote kids who will become hybrid kids. So we are trying to free up that stage space and that cafeteria space in the event that kids will need those spaces, you know, to accommodate lunch. Yeah, so we are moving an awful lot of furniture into storage containers right now.
Okay. So by the way, just a side note, you talked about our little video was kind of expired 48 hours in. What we might want to consider is making school-specific videos that could then be hosted on their websites as well as promoted on HCAM. So if one thing changes, we can just swap out that particular video.
Yes, that's really helpful. And I think today we have some SROs who are going to be at school resource officers who will be at the Hopkins School to kind of, you know, navigate the traffic flow there. There are just, it's funny if you kind of analyze it, there are small spaces like into the S curve in front of the Hopkins. If, you know, parents will stop and just let 18 buses through at once, it feels like an awful lot of traffic going through when 18 buses go through. But once we get those kids and buses out of the way, then the traffic actually flows a whole lot more freely. So yeah, that's part of our goal, is to just get people to a place where they understand where the gridlock is, and then we can work on it. So
Right.
Yeah.
So you had some amazing first days as far as cars coming in and lining up for eternity. And so a change has been instituted, and the things look good. Do you think so far it looks good? Do you think you're still examining it and as a work in progress?
Yeah, it's a really strange situation. I think we have some very good days and some very not so good days. This morning, for example, out on Hayden Row Street, didn't feel like things were flowing very smoothly. But last Friday, I was out in front of the school, and you know, if someone is there to kind of direct parents, it seems like things will work a little bit better. So when I can be, I'm out there. I know Mr. Bishop is out front. I'm sure we have people out back making sure that the kids are getting off the buses safely. And then we obviously have our middle school administrators who also need to be now inside the building so that they can be watching the kids, you know, a little oversight in places where we are bringing in, you know, parent drop off earlier than 7:15. So yeah, I think it just takes some getting used to.
So if you had a teacher who was teaching a class and had to be there for first period on Thursday, what would you recommend that teacher get there? What time you think they should arrive?
I usually arrive somewhere in that vicinity of 7 o'clock. And so, you know, the funny thing is, if you arrive at 5 minutes of 7, you are in the free and clear. If you arrive at 5 after 7, you can't get to school that day. You know, so there, in that 10-minute window, the way traffic will back up, I would just say that, you know, and if I tell everyone you should shoot for 5 minutes of 7, then we'll have a problem at 5 minutes of 7. I think that we just have to kind of keep people flowing, and there's a way to do that. If one of the things that we had noticed at the high school was that, you know, I understand we're not allowing kids into the building at the high school prior to 7:15. So there are some parents who will wait in that line. What we'd ask them to do is just find a parking space and then let your child out at 7:15, because if they start queuing up, then there's nowhere for people to move it off of Hayden Row Street. So we have no problem with keeping your kid in the car until 7:15. Just finding a parking space would be helpful. So there are little tricks that we think can prevent gridlock. We just need 100% participation on all fronts.
Right. Do you think, I don't know, do you think that the downtown construction project might have an impact, or is that too far away to really be a presence?
I don't think that they start that early in the morning. I think they start later on. But I will say that that could be a problem with afternoon dismissal.
Mhm.
Because if that slows down even one, say Hopkins bus, for example, that will slow that bus in getting to Marathon or getting to Elmwood. And once those buses start to get slowed in the routes, all bets are off.
Right.
Mhm.
Okay. All right. Now, tell me about what your first day of school was like this year.
Oh, it was actually wonderful. I think when we talked last week, I had said, I kind of kept my calendar very clear. And one of the things I had in the middle of the day might have been a meeting with the commissioner. But for the most part, we made it to all 5 schools. We were able to see lunch at the Elmwood School. We saw lunch at the high school. Got into Hopkins, I think, just after lunch had been served. But some really cute things, when you're in the Elmwood School and there's like a second grader there. So obviously this is her first day ever in that building. And you kind of forget, like, this is a magical thing for her because she's a second grader now. And so she told me how beautiful the cafeteria was. But she also said to me, I am sure you know Ryan, who I assume was her older brother. And we chitty chatted and it was just nice. I got to Hopkins and there was a girl who came over and introduced herself. She said, hello, Mrs. Kavanaugh, I am Caitlin, and just told me what a great day she was having and so happy to be back at school. And, afterward, I got a note from Caitlin's mom saying it was my daughter, but I thought, what a sort of confident, kind of assertive child to just come right up and have a conversation. It was really lovely to see that kind of agency in a 10-year-old or a 9-year-old, So I had a wonderful first couple of days interacting with kids. It was so good to see them when you haven't seen them since March 9th.
Right. And how are the little kids doing with their mask wearing?
You know what? You'd be very surprised.
Yeah.
We watch them come out of buses, come out of parents' cars, walk into the building. They stop at the hand sanitizer, they sanitize, they go off to class. And I don't think that they think about the mask anymore. Maybe because it's just been such a long time that they've been wearing them that they do a really good job with them.
Mhm.
Yeah.
Well, that's good. I'm really glad to hear that.
Mm-hmm.
We do have a question before we continue on with our conversation. Adrian asked us, I'm wondering if we'll see a ramp up in the amount of in-class learning and schoolwork being sent home. For example, my 5th grader hasn't been assigned math or social studies work yet, which is a little concerning given that we're almost a week in. I feel like she's falling behind where she would be in a normal school year. So let's talk about that.
Sure. And I would say that Adrian's question to you right now is probably not dissimilar from a few that we have received over the last week. And I guess I'm really just asking for parents to give us a little bit of that kind of on-ramping time. I think we are, I think what parents don't realize is if their kids were in school in a typical year, we would spend an awful lot of time with routines. So what does it mean to, line up, and what does it mean to walk in a single file line, and what does it mean to all sit in a circle, and what does it mean to have questions and answers in a morning meeting, or all of those things that we spend an awfully long time with at the beginning of the school year. So our teachers now are in a place where we are just learning something new called Schoology. And Schoology in grades 4 to 12 is that brand new learning management system. I think I talk about it every time I'm on the show, but that's been a really big learning curve. And our fear in putting a lot of stuff out there on Schoology is what's going to happen if we have parents who say, oh my gosh, I really can't even access this Schoology thing. So now my child and I are sitting here and we're kind of desperate. I guess I would just encourage parents to give us a little bit of time before we get all of that ELA and math and science and social studies and all of that up and running kind of fully. So, in some ways, we've seen our green kids on Wednesday, then on Friday, and then again today. So this is the 3rd day that some of our kids have been physically in school. So I know that on those at-home days, it must feel like, my goodness, people, hurry along. But there is kind of a slow and steady process, I think, that happens. So I've gone a long way to say, a little bit of time, and I promise we will get there and build momentum and stamina and get all those assignments out to families so that we can be very sure that kids are, in this model, we don't expect kids to cover what they would cover in 180 days. Our days have been reduced to 170. The at-home days are supposed to forward the curriculum as, much as we can push it ahead. But, as a school district, if we can get through 70% of our curriculum this year, we're going to feel really great. And I can tell you that, I don't necessarily know that anyone else is going to exceed that. So we're doing probably the best pandemic job we can do.
And as I do teach one class, and my class is kind of different than many of the other classes that are in our school system. It's very hands-on. We're working with cameras. We're making a TV show. So it's different than if I had students lined up where, go to chapter number 2, we're going to learn some information. And so I was very concerned about how I was going to do this and thinking a lot about not only, I have to teach everything twice now that I do in class and then have something for the kids on the off days while I'm in class with the other kids, but also just how different the experience is going to be. And from my own personal perspective, I think that there is as you said, there is a ramp up that goes on. There is a getting used to it. And what I really, really like is that the kids are the kids, and like I get the same kind of questions and I get the same kind of feedback that I do just on any school year. So it was really interesting for me to get to a point where it's like, yeah, you know what, this is different. Like things are set up differently, but the class is the class and the information is the information, and we will make it work.
Yeah, there are so many ways I think that we have adjusted things and compensated with things. I don't know if families have been able to see something like Doug Scott, who is the subject matter leader for middle school and high school in science, technology, engineering, business, those kinds of robotics, those kinds of subjects. But he put together a video that was, how has the shop changed? And there are still ways for kids to bring a project over so that the teacher and the student can look at that. But he's got, we're wearing gloves. You're on the other side of the plexiglass. We both have masks on. You're showing me how your project is working. I'm asking you questions. You're going back using the engineering process to revise and revisit. And his video just sort of speaks to it all. Like, here's something that you are going to tap with your foot so you don't have to touch it with your hands. Here's a way that you're going to go to the robotics pit and touch your project without having to touch your project. Like, it's just so interesting.
It is. And I get a piece of plexiglass in my class too. And there is very few things as awkward as trying to communicate with the student through plexiglass, right? But you know what? Once you start talking about it, once you get into it, all that stuff just goes away. And they're really just focused on what they're learning.
Yeah, you kind of forget the plexiglass is there in the same way that our little kids are forgetting the masks are there, In the beginning, it's like going to the bank teller, would you like this in small bills? Like, that's what you expect the question to be. But, then all of a sudden it's just teaching and learning.
Right. Can you talk about what kind of feedback you've been getting from parents during this time as their kids are experiencing the school system and what they're saying to you? Sure.
And that has been, I think all of the building principals have felt sort of the same way. And it was really interesting. I'll share a Mr. Keller secret. I think it might have been, I don't know, the second or third day of school when, he said there were moments in the summer where we had to question, sort of, what are we doing? This is crazy. How much money are you spending on masks and plexiglass? And what if you don't get it right? And what if you're shut down on the Thursday after the beginning Wednesday? And all of those questions, and we're rescheduling and then scheduling again and then still scheduling. And it was so crazy all summer long. But once kids came back, it felt really, really good. And I think we've been validated by parents. And this is where sort of the answer to your question comes in, Jim. So on the very first few days of school, standing out in front of the high school or the middle school, and parents would like sort of stop and roll down their window and say, thank you for all you're doing. And I think that was really validating. And then we got email from parents saying, my kids have been, kind of slumpy all through August. And now they've gone to school and come home and they are entirely revitalized. They're smiling, they're chatting, they're associating with friends that they haven't seen in a long time. So I do feel like it's been a worthwhile endeavor, and it's been hard. I know that, whether you are an administrator, a para, a custodian, the director of building and grounds, cafeteria worker, one of our teachers, central office administrator, it doesn't matter who you are, this has been so hard, and now it's all paying off. And we feel, I think, really good as an organization.
Yep, I agree with that. You know what? As we know, as we say all the time, Hopkinton has the best public school system. It's just awesome. And one of the things that people have seen me talk about it is the level of caring that the staff and the teachers have. The staff have always been like, everything that's important is what's inside your classroom. And we are here to support you in doing that. So I felt very affirmed by that. And the teachers, just have tremendous stuff going on in their classroom. The engagement that they have with their students and the projects that they come up with. And, just you could spend all day talking about the awards and the recognitions and the amazing things that go on, which include Mr. Scott getting an incredible teacher award this past year. This is like, all these things are like really good. And this has been so strange, so weird. It's, teachers have been working on this since March, April, May, thinking about, how to teach in this environment and what is the best way to teach in this environment. And it is really exciting to have some interaction, to have some, I don't want to say normalcy, but as close to normalcy to our experience as we can have at this time.
Yes.
I also am very excited whenever I look at what's been going on in Massachusetts with what I think is the most important number, the 7-day rolling average of infection rate, and it's like 0.8. It's, I heard the rate, it was like second best in the nation, but I don't know if they're including Alaska, where I don't think there's anything going on in Alaska. But anyways, from a very difficult situation down to 0.8. So I'm curious, what have you seen? A lot of school systems are opening up now. Some of them are going full remote. Some of them are going full remote for a month and then coming back. Some of them are doing hybrid. What kind of feedback have you been getting amongst your peers?
Yes, so I have actually gotten some feedback, even from parents who will say, we talk to parents in other communities and we are so happy that we live in Hopkinton because, our doors are open and our kids are getting what they need in those classrooms. But yes, a lot of my superintendent peers, so one of them had said she really wanted to open her buildings, but she couldn't because she could not establish 6 feet of social distancing no matter how she tried it. So we are lucky to have the buildings that we have. And then, some of the others who took a really cautious approach and said, let's try to open on October 15th, for example, just to see how things fell out in other places. But, we didn't take that approach. We said, if we're going to do it, let's just dive right in. And that's sort of what we did. So I'm really pleased with what we have done here. And I agree with what you're saying about, our teaching staff. Now, one of the things that's interesting, I think, about when you go to a full remote model, you've got to start thinking as a teacher, what is it that I can give kids that they can do autonomously? And then what do I spend my really valuable sort of face-to-face time on? And even the face-to-face time when you're fully remote is a little bit limited, I think, in that the conversations that we're having are like this, electronic, right? So, I think that with our teachers being able to communicate face to face with some of our kids, most of our kids, it just sets up a little bit different dynamic. You know what I mean?
Yes.
So yeah, that's been really nice. I've been very pleased with how things have kind of fallen out. And I think even when we talk about our remote kids, I think that they're getting an excellent product. We had a meeting of all the administrators this morning, and we talked about, so let's take our remote teachers and make sure that they too have PLC time and time to check in, and to be sure that they have all the technology that they need. So we want to support all forms of learning, and I think we've been able to do that. Our CARES Act money has been able to buy not just a lot of plexiglass, but an awful lot of technology too. So if you are someone who is going to be a fully remote teacher and you have to be able to see kids in your classroom, we've been able to buy like very big monitors for you so that you can see. Your Brady Bunch isn't little Brady Bunch, it's big Brady Bunch, which has been really great.
Right.
Yeah.
All right. So we are transitioning to a half-hour segment now that many of the decisions that you had to do have been made, and we're keeping up with that. But I'd like to just, before we run out of time, I'm wondering if you can say, over these past 7 months, are there things, parts of your job that you have had to put off or delay or put on hold while you and your administration's attention has had to go to figuring out everything, and what you're looking forward to getting back to once we get a little settled there?
Sure. I think most of what we have all been doing has been managerial and operational. Like just ordering things and reading about whether your windows should be opened or closed, does your HVAC work, all of that kind of stuff. What will really be nice is we can get back into the business of, for me, 2 things. One will be a really nice, strong focus on teaching and learning. I always say that classroom, that's our business. That's the business that we're in. We're not in windows. We're in kids. So we'll be able to get back at that, I think, quite a bit. And the assistant superintendent, Jen Parson, has done a really nice job of trying to get everybody ready for what does remote learning look like, because whether you are hybrid or fully remote, you've got some remote learning on your plate. So that's been really important. And the second thing for me is when I kind of came into this role, we started doing a lot of work in, diversity, equity, inclusion, social justice, culture, all of those kinds of pieces. And again, that was something that we have not talked about in the longest time, but I think we can start getting back to that too. So there are aspects, I think, of kind of education and humanity that will kind of come back into our schools as our kids come back into our schools and our faculty comes back in our schools, so we can stop worrying about the managerial pieces and start thinking about what our true business is.
Okay. So I have a question that I've been wondering, because as I have heard about technology coming in and all this remote learning and all these capabilities, will we ever have a snow day again?
Well, it won't. I don't know about this year for sure, but it will be interesting to see, because I know that the commissioner is not a fan of the snow day done remotely. And he is not, because, well, I guess it was interesting when Aiden McCann, who used to be one of our assistant principals at Elmwood, lived in a community where they did the blizzard bag thing where you could pipe out the snow day. And he said, both he and his wife were working from home, but it felt like there was just so much work to do on that snow day done remotely with his kids. Now, all of that has just been, upended, because we all know how to do that now. But I do think that there may be issues of inequity when you start to push that out, because not every parent can be home. Not every parent can assist their children. Not everyone has the technology in the household. So I don't know that the commissioner will love that idea. And we always have to remember, he's not thinking with the lens of what does it look like in Hopkinton? He's thinking about what does it look like across the state of Massachusetts. And there's a lot of economic disparity in our state.
Right. Okay. Well, listen, thank you so much. And It's been an exciting week, and we look forward to talking with you more and talking more about some of those things that maybe we had to push aside for a little bit, but once we get our feet under us, we can get back to.
Absolutely. All right. Thank you, Jim.
All right, I will talk to you soon.